Hi YouTube. So this is your girl T Shane coming at you today, and then I'm just, coming at you to talk about something that's real life with me. Um, so this is 2015, the month of March, and a couple of weeks ago, I was about 20 weeks pregnant, and unfortunately, um, due to a prior medical issue, I had a second trimester miscarriage. Now, I already knew that during my pregnancy I was high risk, but I did not imagine that the situation was as serious as it was. Unfortunately, it did cost my son his life, and I'm still reeling over that, you know. But this is actually a video coming to you basically to tell you what um, I am dealing with more so than the miscarriage itself. So I'm 26 years old and I'm African American. College student, decided to wait until after college to have children, and to wait until I was in a committed relationship with someone with whom I trusted to be not only a good husband and good person in my life, but also a good father. That is one of the biggest things that I've always looked for in men I've dated, which is weird, but I mean, it's me. I've always looked for someone who I thought would be a good father, because I've always seen men come and go in my mother's life, and my mother has, several children, and with these several children, their fathers are ridiculous, with an exception to mine, of course, because my father, he was a great father. Even though my parents weren't together, and they had me young out of high school, my father was always very active in my life up until the day he passed away from cancer. Now, speaking on my family history, cancer, my father had cancer. That he died when I was 8 years old from cancer. And, cancer being in the family, it's something that's kind of hereditary. So on my paternal side, my father had cancer, and on my maternal side, my grandmother had breast cancer. And so with me having it on both sides, it's kind of like you don't expect to get cancer, but it's in your family history, especially on both sides. So you kind of try and do a lot of things to help yourself in that type of area. Let me see. But so one of the things that I'm dealing with is um, cysts on my ovaries, which are painful. They don't really cause any problems, but they are very painful. But the biggest thing are my fibroids, and I have two fibroids. One was when it started out, it was about 7 centimeters. I found out I had these fibroids in October of 2013, and I directly went on, a vegan diet to try and shrink them, to see if that would cause any difference or anything like that. However, about a month later, I ended up moving from my home state of New Jersey to the state of Texas with my fiance. He joined the Army, so we are now living in Texas. And moving to Texas, basically, I lost all that veganism that I had been going on, for 3 months. And I began to eat meats and things like that. And then I found out, I was pregnant, and that's why I was craving certain things that I hadn't been craving before. So, yeah, I was pregnant, and the fibroids grew from about 7 centimeters apiece to one becoming about 10 centimeters large. And if you don't know, 10 centimeters is about the size of a grapefruit. Um, it's pretty big. It's pretty big. Even lying down or standing up, sometimes I can feel the fibroid now in my body. Um, it causes severe pain. I mean, I had never been in so much pain in my life, and I was in pain for most of the pregnancy. So one of the things that I'm going to do is, because of this situation that I put both myself and my child in, because I didn't take the initiative to do anything about it, even though I was told that if I was to try to do anything, I could possibly make myself infertile by having surgery. So I chose to wait to see what would happen. My doctors told me that there wouldn't be a problem getting pregnant, and I didn't have a problem even though it wasn't planned, but that I would have a high-risk pregnancy. And unfortunately, the high-risk pregnancy ended in loss. But one of the things that I am going to do is I am going to go on a water fast, a 21-day water fast. So these videos are primarily basically to start up or give you the backstory of what's going on and to document my progress as I go along. So one of the things I did want to show you, however, was this is the last ultrasound I received. This is in the beginning of my second trimester. And if you look here, you'll see this is my son. He's just, laying there. And directly on top of him is the 10-centimeter fibroid. So although this fibroid was not hurting him, it was actually causing problems because there was a bit of placenta. You can't see it, but over here there's a bit of placenta where his placenta was developing on top of the fibroid. Now, if you know anything about fibroids or tumors, benign tumors, it was taking all of his nutrients and blood supply and things like that, which was basically providing him with oxygen. The placenta was his lifeline, and the fibroid was actually depleting everything that he needed, and that's what caused the miscarriage. So today is it's been like a week and a half, I think, and today is the first day that I have decided to go on a 21-day water fast. And what I'm hoping to accomplish in this water fast is just to basically shrink the fibroid, to deplete the fibroid of all estrogen, any type of estrogen that could possibly come into my body. I want to block that. And with the water fast, basically, because I'm still on medication, pain pills and things like that, the way I'm going to do mine will be a little bit different. I plan to have one it's a hot cup of lemon water in the morning. So I'll have a cup of warm water with 2 teaspoons of lemon juice, and I'll drink that as a detox, a morning detox. And that's basically to go ahead and, detox myself from the night before and everything like that. And I'm actually having that right now. And so I'll do that, and then after that, I'll have an apple, a pear, or 2 handfuls of grapes, just to have something on my stomach because I'm cutting out dairy. I can't have a glass of milk with my pills, and I need to take my pills. I need to continue to take my pills so that I don't become sick or get infection or anything like that. So I'll go ahead and eat the pear or the fruit, and then I'll take my pills with a glass of water. I'll be drinking between 10 to 12 cups of water a day, and I'll have 1 piece of fruit in the morning at breakfast time. And then for the rest of the day, I will be drinking water only. And I plan to go up until 21 days is over. And once the 21 days is over, I will be seeing my doctor again. I already have a scheduled appointment. That's why I'm doing this now. So hopefully, by the time I get to the appointment, we will see some shrunkenness of the fibroids. They want to operate on me because the fibroids are very large, but I'm very afraid of that because I was told by my specialist in New Jersey that an operation would possibly mean scar tissue on my uterus, and scar tissue on the uterus would possibly mean being infertile because the blastocyst or the embryo will not be able to implant in the uterus in a cozy enough spot to go ahead and develop properly. So what I'm trying to do is shrink the fibroids naturally in order to avoid that. Also, I want to do this detox just to get all the toxins and things out of my body, and then in the beginning of April, I do want to start eating a more vegan or plant-based lifestyle, cutting out dairy with a lot of estrogen, soy products with a lot of estrogen, meats that have a lot of estrogen or xenoestrogen, which is fake estrogen, but I want to cut all that out, just to make sure that I'm living a more healthy lifestyle to prepare my body and my uterus for a successful pregnancy in the future. So I'll be making videos every 3 days on this 21-day fast, just to make sure that I'm keeping you guys updated, to make sure that I'm giving myself a little bit of motivation, and just to make sure that you know, I can document and I can see what's going on with my body, with my everything, my hair, my nails, my everything. And I'll come back later, probably in the next 3 days, to tell you, because that's supposed to be the roughest time, to tell you, you know, everything that's gone on. So pray my strength in the Lord. And if anyone else is, you know, dealing with something like this, come on and take this journey with me if you're in okay health outside of the fibroids. And, you know, let's beat this thing together. You know, all things are possible through the Lord. And I'm just praying and hoping that, you know, I have some friends out there who are willing to definitely stand by me with this. Thanks for listening, and you have a blessed day.